And for more, we're joined by Professor Talya-Miron Shatz, a healthcare expert and also a visiting researcher from Cambridge University. Thanks for being with us here, looking at the situation in Israel. The numbers only going up day by day now. The government seemingly doing all they can to avoid the harsh economic impact of major lockdowns and shutdowns. But how much longer will they have that option?
That's a great question, and some of the answer depends on us. So whether or not we vaccinate, there are 1 million people who have not yet had their first vaccine. I find that incredible because we now know we have the data to show that people who have had a second vaccine are much more protected against COVID. They are much less likely to be hospitalized. So I think people should really take on the responsibility. There's so much the government can do. It can force us to do various things. It can force us to mask up when we go outside. It can't really control whether or not we wash our hands and whether or not we maintain social distance. And it can't really force us to vaccinate, but it's on us. And I'm sure none of us are looking forward to a lockdown for Rosh Hashanah. That is not a way we want to spend our holidays. So we should help the government in protecting us.
And among the issues on the agenda here, the school year, so soon now, just really a few weeks from now, the majority of the country due to go back into schools. We should mention the ultra-Orthodox sector already back in schools, but so different from previous waves. The outbreak is not in their communities in any large numbers yet. But with the school year approaching, you've seen clearly some of the plans put forward around a testing regime that would avoid quarantines. Does it seem realistic to you, the plans being put forward by the Education Ministry in conjunction with the Health Ministry about how the school year will commence?
I think we need to accept that none of this is going to be perfect, none of this is going to be great, and that there's going to be a lot of uncertainty. We're living with uncertainty the whole time. I think we can decide to ignore COVID and then just whatever, have people be sick, have people die, not a great option. We can completely go into shutdown, and that's what we did, and that was also really difficult. And we can plan to live in a way that is far from ideal and is far from easy, but does protect most of the population most of the time. Whether or not it's realistic, I think the government is very good at implementing programs, first of all, creating programs and plans for letting us live with COVID. I started thinking about it as the new chronic condition. And if you ignore a chronic condition, it's going to come back and bite you. But if you do your best to curb it, I think you can live with it. And that's what we are all trying to do.
Well, Dr. Talya-Miron Shatz, thanks for being with us on the important subject.
Pleasure.